Thanks for coming virtually and in person. We'll be talking about different models of practice and how people have come about and done obesity care over a long time. I am Pankaj Rajvanshi, one of the Chief Clinical Officers for Fusion Care AI, which is an AI-enabled human-powered obesity care network, first one in the country. So I'll pass around to everybody and let them introduce my panelists and see how their story about obesity care came about, and share a few words, and then we can take some questions between us and then open to the audience.
All right, well, I'm Carolynn Francavilla, and I am a family physician and obesity specialist. And I support starting practices with a platform called HelpYourPatientsLoseWeight.com. And I started my practice about 9 years ago as a primary care and obesity practice. We took insurance, pretty traditional model, and over the last couple of years have evolved to a insurance plus membership model. Really have just evolved in lots of ways over the last 9 years, incorporating more and more telehealth and asynchronous care with messaging our patients. And happy to talk about whatever questions people have.
I'm Sandra Christensen, and I am an obesity medicine specialist, and I've been treating obesity for 19 years. I started off in a hospital-based outpatient clinic and learned, I didn't realize it at the time, but I learned how to be an entrepreneur because of the type of clinic that we had. And then after a little over 4 years, I left and opened my own practice, which was 15 years ago, integrated medical weight management in Seattle, Washington. I'm a cash-based practice. I have a concierge model, and we'll talk more about that when we do question and answer.
Hello, my name is Karlijn Burridge. I'm a PA and an obesity specialist. And I started managing obesity about 13 years ago. I started out in metabolic and bariatric surgery. And in the last 13 years, I have started 4 or 5 programs from the ground up, both in bariatric surgery type settings, in hospital type settings, as well as in primary care. And I support clinicians who want to start an obesity practice or program through gaining health. What I realized at starting all those programs from the ground up was every time I was kind of repeating the same process. And so it just seemed crazy that every time I was starting a new program, I was having to start all over. I was creating all the content and structuring the program. And so I decided to go ahead and do a lot of that legwork for people so that when people start their practice, they don't have to recreate the wheel when they're starting a new obesity program. So that's kind of where that idea came from, and the settings that I've worked in all cash practices, all insurance, combination of cash and insurance, and so I really think there's not a one-size-fits-all when developing an obesity program or practice, and so it's really about what you as a provider, what your vision is, and how you would like to run your program. So I love hearing people's ideas, and I'm excited to be here with you all today.
Thank you. I know that you run an excellent program to coach people to start their practices, and you do, Karolynn, too. So when people come to you, the new people interested in starting a practice, are they all starting a new practice, or are they adding a service line? And what are the top 3 barriers you see they have?
Yeah, so we have a variety of people that come and reach out. I think one of the issues is we come to conferences like the Obesity Medicine Association conference, where people get board certified in obesity or they get educated, and they have all of this knowledge and all of this information that they've learned. And now the question is, how do I implement it, right? How do I take all of this information and put it into a structured program? So I'd say that's one of the biggest questions that people have, is how do I actually structure this? So I definitely help people figure out a structure that works for them, and it can be individualized for each person, but figuring out a path toward that. And then the second thing, I think, just developing a business plan, or having some kind of a plan when you're starting from nothing and building towards a comprehensive program. What does that look like? What are all of the things that you need to think about and take care of, and doing it in a way that kind of creates a roadmap. And again, developing business plans and things like that is something that we weren't taught in our medical training, and so many of us didn't have this experience with that. And then I think lastly is just some of the practical practice management type things. There are a lot of questions around EHR systems, billing services, those types of things, malpractice insurance. So what I really love with the counseling that we do now, it used to be that I just had the products and services and people would just purchase those. And then a lot of people said, well, I have follow-up questions. I'd like to meet with you and do some one-on-one consulting. So I was doing that for a while, but a lot of people had similar questions. And also a lot of people that are starting a program on their own, it can be a little lonely. And so we created this group coaching session so that we're all supporting each other in the process as well. And people can share their resources and ideas as well. So I really like the group aspect.
And Carolyn, I know that you have an academy type course that
I could just say ditto. But I do think exactly what Carly said, which I think we were getting the same questions over and over, is people would learn so much. They would take the exam, they'd go to the fabulous CME that is offered here and elsewhere, and they didn't know how to do it in the real world because they'd never seen an obesity specialist practice. And so they were like, what does it look like? Like, what do you do at the first visit? What do you do at the second visit? How do you bill? And so, the course that I've created at Help Your Patients Lose Weight, same thing. And then same thing, it's just like so amazing that we're like solving the same problems, right? People were like, what about the business, right? So I have a mastermind that we do for 6 months where we work through all of that. And I would say the top challenge that people have, and I work predominantly with physicians, is that, like you said, we don't learn the business skills, and people are very afraid of business. We think that business is as hard as medicine, and we've been kind of told that by hospital administrators and people who employ us. And business is, it can be super complicated, but not for us. I mean, like for a practice, it's really not that complicated. So I would like to break it down that, running your business just requires you to do two things. The first is to make money. If you're not making money, it's not really business. So it has to be profitable, right? How profitable is a little bit up to you and what you need in your life and what you want, but it has to make a little bit of money, otherwise it's not really a business. And then the second thing is it can't break the law to accomplish anything. Right? And if you break it down into that's simple. It tells you all the business decisions you need to make, right? Is this going to make money? Is it legal? And you may have other considerations. Do I want to do it? Do I like it? Is it ethical? Whatever. But those are really like basic business principles. And so I really try to break things down really simple, make people less afraid of having their own business, having their own practice, because it really is often the best way to provide patient care. And I think most people are happier when they have the autonomy and independence of having their own practice. So really trying to help people focus on what their goal is, why they want to practice, and then taking the fear away from having their practice.
So, very well said. And, risk is what you have to take a little bit. And talking to lots of physicians who want to initiate their own practice, that was number one question that came up. That, I'm doing this, it's making me this much money. If I leave or start something new, will I succeed? And you left a hospital system 19 years ago to go 15 years ago. How did you do it? What was your thinking?
Well, I'll just say that I never thought I would ever start my own practice. And I was in this great situation that suddenly changed, and it became, I thought toxic, and I didn't really want to work there anymore. And a light bulb went off, and I thought, you know what? I already learned how to do a program. I'm going to do this on my own. And I have never looked back. I recall that first day when I was, I had a lot of patients that followed me, but I didn't have a full schedule. And I was sitting in the chair, and I thought, oh, I got to do this and this and this after work. And then I knew I had a gap in my schedule. I was like, I could just take care of that right now. And I looked over both shoulders. No one's looking over my shoulder. I can do whatever I want. And it was so liberating. And what I find, because I've helped several people start their own practices, different models, some like mine, some more of a traditional clinic, is that people are afraid. They're afraid, what if I don't get patients? What if I can't make it? And all of them have been very successful. We could have a clinic on every corner, and we still wouldn't have enough people treating obesity. And all of the people that I've helped have a long waiting list, just like I do, And so it's really liberating to be able to do it your way. I was just talking to Susan over here a few minutes ago about what I love the most about my own practice is that I don't have this bureaucracy that I have to work through. And that's just so draining. Like in the system, it takes you 9 months to get a handout approved, right? And you want to do this and you want to do that, and to be able to do things in real time and to do it your way and really put your heart and soul and creativity into it. And you can spend so much more of your energy building your business and taking care of your patients. So that's what I really love about having my practice.
She's a very serious person, but when I was talking to her to do this talk, and she said, "Oh, my boss is a very hard taskmaster." And I usually am good in picking and choosing. It took me seconds to dawn upon that. Yes, she was the boss. So great. So when people get started, when you believe and they want to start practice, the lowest hanging fruit I see in the market right now is to work for a direct to consumer tele company that will pay them an hourly rate and they can counsel patients and prescribe medications if need be. How do you envision providers go out and do something that they can build their practice and also keep the ancillary revenues in-house? Like, how would you just not be consultation based, because that's how primary care is done, and in every specialty, if obesity care is going to stay as a specialty, how would practices could increase their revenue other than just providing consultation? Do you see any models for that?
So are you saying rather than just somebody comes to you and you give them a plan and off they go?
What are the other ways to?
What are the other ways?
To
So I'll share my model, which is I set up as a concierge style program. And so I charge a monthly fee, and it's based on the frequency of appointments. So in the first month, I see people once a week, and they pay a higher rate for that. And then after that, I see them once every 2 weeks. They get longer appointments. And then that really helps me guarantee my income, right? And it gives them that regularity. We know that frequent contact, we've heard that in the conference, is associated with better outcomes. And what I find in that model is that when people are paying, they show up for their appointments for the most part. And so it's much more fulfilling for me as a practitioner, right? And I really get to build these deep relationships with my patients. I have people I've seen, 18 years that, follow me over. My oldest patient is 93. I've been seeing her since she was like 77. And I go to all her big birthday parties. And so that's what's really worked for me in terms of generating revenue and keeping it pretty steady. As I said, I'm a fact-based practice.
Thank you. Carolynn, yesterday we talked a lot about marketing and how to do that, and there's a separate webinar. But what do you suggest? How could, like I heard Ethan Legend's practice, they have a huge meal plans and like a food store.
Yeah.
So what are the options?
Yeah, when it comes to revenue, you want to find something that's in line with your values and what you want to offer to your patients that makes sense for them. Historically, there certainly have been a lot of people in the field and leaders in the field that have utilized meal replacement programs. And so that is something where nowadays you don't even have to have those in your clinic. They can be directly sent to the patient. And you probably met with multiple vendors if you went to the innovation hall at all. There are options for those. And meal replacement programs, I think can supplement our newer medications really well, but they're also a great alternative. Before we had really powerful medications, the mainstay of treatment was these very low calorie diets that were done with meal replacement. So that's an ancillary service. Some people who are in person will dispense medications like phentermine and medications like that, the oral medications. And so that's a way that some people have generated revenue in their practice if it's bigger. And then we have more modern solutions, tech solutions. So things like remote patient monitoring, chronic care management, which are billable codes. But some people are doing those in a concierge way, where these are cash services. And so maybe the patient is putting their data in, whether it's logging their food, their weight, their blood pressure, their sleep, things like that. And that's something you're monitoring or giving feedback in some way, potentially with a coach, potentially you. I'm guessing AI is something that can help with this. And so that would be sort of like some more modern solutions. People will use tracking devices like the InBody and the Sika and charge additional for that. So, you know, anytime you're seeing something that you might want to add for your patient, it could be additional service lines that you are charging for. And I think if it's something that you believe in and you want your patients to use anyway, then it'll be a natural thing to add to your practice. Don't do it just to make money, right? Because you're not going to use it very much. It won't be worth your time or investment. But if it's something you really believe in, whether it's a supplement that you sell, meal replacement, InBody, whatever, if it's something you believe in, then you're going to want to share it with your patients. Carly has something to do down there.
Yeah, and I think you pretty much mentioned most of the supplemental things that people could do to add revenue. One thing I would just add is just be sure to always stay evidence-based when you're looking for additional revenue. But meal replacements are great, and they are evidence-based. When we saw today, 15% body weight loss, and even the look-ahead trial and things like that, they use meal replacements, so they are evidence-based. So those are great at body composition. And a lot of times people can roll things like body composition analysis or remote patient monitoring or things like that into a program fee. So even for insurance-based programs, if they have certain things that otherwise would not be covered by insurance, like body composition analysis is not covered by insurance, if they're doing educational classes or have videos, educational materials that their patients can view or have access to, that's not covered by insurance, right? But it still adds value to the program. So what a lot of people will do is have program fees. Sometimes those are charged kind of on a monthly basis, kind of like a subscription, sometimes an annual fee. And I think kind of getting a commitment from your patients for a certain time frame is helpful as well. Because as Sam mentioned, if they have paid for something, they're going to come because they want to use it. And we know from the research that patients do better if they follow up with us more frequently and stay in our programs for at least 1 to 2 years, ideally, obviously lifetime, but maybe at some point they can have a primary care provider or somebody else take over that care. But really for them to be engaged in a program for at least a year or two is very important for outcomes. So the program fees are another way that additional revenue that can provide those services that otherwise may not be covered by insurance.
And Sam, I know that you have an integrated practice. How do you do nutrition therapy or psychological counseling, behavioral counseling, or coaching? I mean, you likely are all in one, but do you guys refer them out or hire them in your practice or have an arrangement? How is it done to make the circle complete?
So the way I was taught was where the clinician did everything, right? So that's how I learned it. And there's pros and cons to that approach, right? There was a time in our clinic where we had a lot of, we had dietitians and therapists and things. And I found sometimes that was hard for people because they get told one thing here, one thing here, and another thing here. And then I would spend so much of my appointment time trying to like pull it all together and help them feel better about the information they were getting. So I kind of incorporate that all in. I do the nutrition teaching and then follow up with them. There have been times when if someone's struggling, then I'll refer them to a dietitian that I know understands the way I want people to eat, and they'll get some further information that way and support. I don't refer to health coaches because I do a lot of health coaching, but I do refer to therapists a lot for eating disorders, for stress reduction, for managing your lifestyle, for dealing with grief, for work challenges, and all of that. I also send people to some trainers as well to help them with their physical activity, if they want to do that. And I do a lot of referrals to physical therapy. So I do it for deconditioning. I send people, because I have a body composition scale, and folks, I diagnose a lot of sarcopenic obesity. And so I refer them to physical therapy to get a program for that. So that's kind of my referrals, yeah.
You have in-house in your practice or?
So I'm also like Sam, where I kind of like to do it myself. And so as the practice has grown, instead of adding, you know, a dietitian or a trainer or something, I've just added more clinicians. So I have 3 other doctors that work at my clinic, as well as a nurse practitioner, and we all kind of mostly do most of the counseling ourselves. We have, you know, I developed all the nutrition plans, so we have them all written down, and they're all on handouts and all part of the course. And they're things that, you know, they're there in their structure. But you know, we refer people to trainers and we refer people to therapists for sure. But yeah, that's been our style that we just enjoy in our clinic. And so again, as we've expanded, we've got more clinicians who want to be holistic and treat the whole person as opposed to fragmenting it. But it really depends on your vision. And so I think that's really important when you're talking about your clinic, is it's your vision. So there may be a part you really like. You might really like the behavior side and you want to do that. You may not like that. You may not think that's a good efficient use of your time. Maybe you don't feel skilled in it, so you want a health coach. And there's no right way to do this. If you're going to have your own practice, it should be on your terms. It should work for you. It should make you the amount of money you feel comfortable making. I don't judge if that's not that much or if that's a lot. Like, that's your decision to make. And so, you know, I think that's the beauty of having your own practice, is the autonomy, right? No one's looking over your shoulder. If you only want to work 6 hours a day, great, you do you. If you love seeing 60 people a day, like, that's your style, you do that. And so that's like, it's your practice. So listen to everyone's ideas of how to do it. But when you're trying to start or grow or change your practice, what works for you, what works for your patients, what works for your life goals is what's important. So I like to do it all. I don't think it's a great business model, to be honest. It's not that efficient, but it's what makes me happy.
Yeah, I'm sure we can help with the fractional access to different ancillary services. How do you do it?
I've done it lots of different ways in the different programs that I've worked at. I have done many of the programs. I did a lot of the counseling myself. I really enjoy doing the nutrition counseling, the physical activity counseling, and that's my background. So it's kind of my jam. So I like to do it all. But like, for instance, but in my current, you know, program, you know, we have 15-minute follow-up appointments. And when I was doing it all, it was usually, you know, 30 to 20-minute follow-up appointments, 1 hour new patient visits. So again, depends on how you want to structure, how much time you want to spend with your patients, how many patients you want to see in a day. That's going to help determine some of that as well. So if you have 15-minute follow-up visits, it might be challenging to do all of those components, you know, in one visit, in a 15-minute visit. And again, it's what you like to do and where your comfort level is as well. You know, we've all been members of OMA for a really long time, and so we feel really comfortable doing all of that lifestyle counseling and certainly referring out when needed, especially for some of the mental health challenges, refer out to physical therapy all the time. So I think it's really important to know your network in your area and get to know it. Really go out and meet the other clinicians, go out and meet the physical therapists, check out their facility, get to know them, because that makes such a huge difference when you're referring. And it'll also give you a sense of how comfortable you are to send patients over there, because unfortunately there's still a lot of weight bias and stigma. And so if you're going to refer your patient somewhere, you better make sure that you feel comfortable with that, that they'll get treated in a respectful way. So, you know, I've done it lots of different ways. So it's whatever works out for your program.
If there was a right answer, everyone would have the same clinic, right?
Right.
Yes. Maybe they do.
I hope not.
Or at least have a model where single practitioners have access to these services
Now that I'd like to see.
without that we're just not dispensing.
Yeah.
So I'll be respectful of your time you have to run, but I'll open it up to questions to the audience. So, yes.
So any advice on marketing? That's probably one of the scariest things, like how to find you, pay you, that kind of thing.
So question about how
So
to
any-
do marketing.
Well, I don't know if people can access. We did a talk on this yesterday. I'm here. So briefly, marketing is a long-term strategy. So marketing is different than advertising. Advertising is a specific ask. You might be paying for a service, putting a billboard up, putting an ad on Facebook. Marketing is a long-term relationship with your potential customers. And so marketing is everything from me sitting up here talking about my experience, to me wearing pink, to my podcast, to me speaking here, to reviews online. Like, those are all part of marketing. And so if you're starting to even think you might want your own practice, start putting yourself out in the world. That might just be sharing on your personal social media. You're passionate about this, your interest, why you do it, that you're even here right now. And so that's as simple as like your little community knows what you do. But you might, if you want to seriously start getting your name out there, decide to do a weekly blog, a weekly podcast, or a weekly YouTube. Don't worry if no one's watching. It builds and it creates content and it starts getting your name out there. So pick something, start putting it out there, give a talk in your community, give a talk at the hospital, but just don't be afraid to put yourself out there. But yeah, marketing, you can either pay someone a lot to do for you, or you can put time into it. And so those are kind of like your two choices. And so don't be afraid, just put yourself out there and be accurate and just be honest about the world. And I think they can't go wrong. So don't be scared of marketing.
Actually, I have to say something about Sam. So the reason we have this panel is that we have done it differently. I am going to do it differently, but Sam is known in our community to provide good care. That itself is great marketing and getting that word out to the doctors. And I would like to hear how you do.
Yeah, so these are things I learned back in my old program, Learn to Be an Entrepreneur. So first of all, when people would come in for a consultation, we would send a letter to all of their healthcare providers, letting them know that this person came in, that they were interested in getting their obesity treated, and that they're either going to think about it or they're going to get started. And then we would send out a copy of the H&P with a cover letter saying, here's what the treatment is going to involve, and we'll keep you updated. And then 3 months, 6 months, 1 year, and then 1 year after that, summaries with tables, that show the lab improvements, the weight reduction, et cetera. And that is one of the best ways to sort of show your work, right? Show that you're making a difference. Show that the treatment that you're offering is evidence-based. So that's a really effective strategy. I recommend having a really excellent website and really paying the money up front for it. I did kind of a cut rate one. First of all, it wasn't that great. And now people, I ask them when they come in, on one of the forms, how did you hear about me? And a lot of them say the website. And I loved your website. So, and the thing to remember about a website is it's not about you, right? As healthcare practitioners, we're used to saying like our CV, our resume, right? It's about your patient and what their pain points are and how you're going to help them. Another trick I give folks is develop some kind of a one-pager that would be of benefit to other clinicians in the area. Go out to their offices and visit them and say, I just want to let you know that I'm an obesity medicine specialist, and give them like some tips on things they can say to their patients or interventions that they can give them or some sort of resource. So something of value, and it can be just a really short interaction. And so when they put the name to the face and see that you're not a snake oil person, right, then you really know what you're doing. That can help as well.
What's the name of your website?
Integrative Medical Weight Management in Seattle, Washington.
It's a beautiful website.
Yeah, I think both of you guys, gave great ideas for marketing. I would just say, one thing is that for most programs, 50% or more of referrals and patients coming in are coming from other clinicians. They're coming from referrals. So I would really focus a lot of your marketing on things that Sam talked about, and getting out in your community. So you schedule a time if you can. So call a clinic that you think, oh, this could be a good referral source. If you already have a relationship with them, amazing. If you don't, it's okay. There's some cold calling. You're going to get rejected a lot. That's okay. But see if you can set an appointment. See if there's an office manager that you can meet with and set an appointment with them. And say, just like to, meet the clinicians for maybe just 5 minutes, just introduce myself. And again, have a one-pager, have some marketing materials ready, and they need resources. All of the clinicians out there, a lot of their patients are struggling with obesity, and clinicians don't really know how to help them. So if you can show them that you're using evidence-based practices, that you have training in this, what what your program offers people. And then like Sam said, when you do get those patients, make sure you're sending initial consult notes, follow-up notes, so they can really see the outcomes as well. You can say, I provide great services and hemoglobin A1C, I can reverse diabetes, because we do it all the time. But when they see it in a patient note, it's different. So I just wanted to add that, to really focus on the clinicians in your area and focus on getting those referrals.
And a couple things to add. So the other thing is, think of the clinician that you're approaching like you're there to help them, right? They have a problem and you're there to solve it. So rather than they're there to like give you referrals, right? Like you speak to their pain points. And then the other advice I'll give is good types of practices to go to are family practice, internal medicine, OBGYN, ortho clinics, sleep clinics. Those are even GI, I think, because they really want to, you're going to help them solve the problem, right? They have patients that need to lose weight.
Yeah, I can send all my patients until I start really in hospital level. I'm a gastroenterologist. Yes.
I have a couple questions actually. So I started practice in September, and my model sounds a little bit like yours, just in terms of it has to pay and the frequency of appointments. How do you handle your prescriptions? Do you do them all the time? Like, do patients? So what happens if they don't pay?
So the question is that you have a monthly payment model, and then you're giving prescriptions to patients, a monthly refill or 3 monthly refill. If they didn't show up or didn't pay the next month's fee, how do you handle the complex logistics? Is that correct?
Yeah.
Yeah. So initially people sign an agreement that they're committing to 6 months. And so what I tell them is you're signing this agreement for yourself, right? Because people get to a certain point at whatever, 4 to 16 weeks or more. And then the same issues that came up for them before are coming up again. And if they haven't committed, then they're like, oh, I don't want to come and see that I've gained weight, or I don't want to see that I haven't lost weight, or I don't want her to know. I'm going to figure this out on my own, and then I'll go back, right? Like all they're getting is being on a scale, right? And so I find that once you get people through that initial 6 months, they get it. And then we just continue month to month. I've rarely had anybody not pay me because it's such personalized service. What I offer is somebody who's going to know you, care about you, and have a relationship with you. And so for anti-obesity meds, of course, the controlled substances, I only give a month's worth. And other meds I'll give them longer. Does that answer?
Yeah, it does. And I haven't run into that issue yet. Just always wonder, like, how will I handle this?
Yeah. I'll also say people pay at the beginning of the month, right? So they're prepaid. Yeah.
My next question is, can you talk a little bit about how big your practice is and if you have the staff, what kind of staff?
Yeah. So I currently have about 100 active patients. Most of them I see once every 2 weeks for 25 minutes, and then others, when they're stable, come every 4 weeks, 8 weeks. I started off just me, thinking that I would, grow and get staff, and I haven't. It's just me, and I find that easier. And what I've realized as I've gone along, I'm like, oh, I really should get whatever, a person that would do this and this for me. And I realized I'm going to have to see 4 or 5 more people a day to pay for the person. And that would be more exhausting to me. I have a lot of, streamlined, like people have a standing appointment time. So it's not all this crazy scheduling, like every other Tuesday at 10. And I, pay people to do things, accountant, and I've hired people at times to do things for me. I pay my grandkids to make up the patient education material packets, and they're great at that. Yeah, so does that help? Yeah, and I don't think there's a right or a wrong thing. It's like whatever you're used to. And I've mentored people that have started practices and they've worked in big clinics where they have staff, and they just can't even imagine not having staff. So they do, yeah, whatever works for you.
Karlijn, thank you very much. You know, I know you have a commitment, and if you have to make it to the dinner, that's okay.